here at the Criminal Justice Commission, and we are here for the first Byrne State Crisis Intervention Program Grant Advisory Board meeting. So thank you very much for being here. Today's meeting is really about kind of kicking us off. I'm going to do a couple of very basic things about the grant, but really today we have the benefit of hearing from Dr. Kathleen Carlson, who will be presenting on gun violence information and data specific to our state to sort of set a foundation of what the issues that we're dealing with. So let me make sure that everyone's getting admitted. Perfect. Okay, so I think we had a couple other members just join. Let me move to the next page. So this is kind of what we're here to do today. We're going to take attendance for our advisory board members. Senator Solman, because you're here, it would be great if you could introduce yourself as well. I think that'd be really helpful. We're going to do some project expectation setting, and this is something we're going to revisit, but it's, as I'll get into, it's just to kind of ground everyone in what we're here to do. We'll get into our presentation. We'll have opportunity. I think this is the big important piece of this meeting really is to hear from Dr. Carlson, opportunity for questions and discussion, and then a public comment period, and then a brief sort of next meeting preview. So let's see, did I miss anything? Real quick, one thing that I think I often assume and skip over is, does everyone know what the Criminal Justice Commission is? So I'm going to do this very quickly, but we're a state agency. We're a state-based policy and research agency. We do statistical analysis for criminal justice data and information. We do research projects, policy work groups, and grant programs, state and federal. And as I've mentioned, my name is Bridget Budbill. I'm a senior policy analyst here. I use she, her pronouns. I also want to give Shelby, you've probably received emails from Shelby, but Shelby's kind of our more behind the scenes, makes things work person. I want to give her a chance to say hi as well.
Hi, my name is Shelby, and I also use she, her pronouns, and it's nice to meet all of you.
Great. Thank you, Shelby, very much. All right, moving right along. So this is our opportunity for our advisory board members to introduce yourselves, and I want to give you the chance to do this in the way that makes most sense for you. So obviously your name, any professional or volunteer affiliations that you feel are relevant. Some of you are here based on your professional life. Some of you are here based on personal life, volunteering. You can share as much or as little of that as you prefer. Pronouns. And then I thought this is again, up to you to define the scope of this, but kind of why you're here. All of us have jobs or volunteering or whatever it is, but kind of what made you interested in participating in this project, I think is helpful to know. So first things first, I'm going to just go down and get a brief roll. And when I am through accounting for who's here, I'm going to go back and see and let folks introduce themselves. So bear with me. Do we have Judge Anne Marie Simmons here? Not seeing Judge Simmons. Okay. Do we have Sheriff Nicole Morrissey O'Donnell? I know she maybe had a conflict. Okay. Peter Klim, sorry.
Hi, I'm Peter Clem, he, him pronouns. I'm a public defender currently with the Office of Public Defense Services doing appeals work. Before that, I did trial work in Multnomah County. I guess the why I'm here because through my public defense career, I often spend my efforts defending people charged with gun crimes, but personally, I have very different opinions on firearms, and I think it's important to do what we can, however we can, to help reduce gun violence. So I guess that's why I'm here.
Great, thank you, Peter. Jeff Howes.
Hi, everybody. Jeff Howes, he, him. I'm the first assistant to the district attorney here at the Multnomah County DA's office. I just crossed over into my 29th year working here. A couple of things I do in addition to this. I'm on the Crime Victims' Rights Task Force. I'm on the Prison Population Forecast Committee. And I think as to why I'm here, one thing that I think Peter and I agree on, and we are on a couple of committees, so we get a chance to agree and disagree, is the need to reduce gun violence. And in my work, I see the devastating results every single day. And finally, when CJC asks me to do something, then I say yes. So for all of those reasons, I'm here.
Great. Thank you, Jeff. Jen Fraga?
Yeah, my name is Jen Frege. I use she, her pronouns. I'm a suicide prevention program coordinator for the Association of Oregon Community Mental Health Programs. And so my why is just being here with wanting to think about the mental health and suicide prevention aspect around just this work and what we can do to help folks in that area.
Great. Thank you, Jen. Do we have Roy Moore? All right. Laura Chisholm.
Hi, good afternoon, everybody. Laura Chisholm, I use she, her pronouns. I'm the section manager for the Injury and Violence Prevention Program within the Oregon Health Authority Public Health Division. And I'm here today for a number of reasons, but learning, supporting work, helping to ensure coordination with the work that we're doing in OHA, which is particularly focused at this point on implementation of House Bill 4045 from a session and a half ago on community-based violence, hospital-based violence intervention programs. Also very involved with gun violence data projects with Dr. Carlson and her team, as well as we have several suicide prevention grants and connect very closely with AOCMHP. So I'm glad to see a lot of new and old friends here today. Thanks.
Thank you very much, Laura. Jess Marks.
Hi, thanks for having me today. My name is Jess Marks. I use she, her pronouns. I run the Oregon Alliance for Gun Safety. I think like most other people, I'm here because I want to see us prevent gun homicides and gun suicides and reduce shootings. And I'm interested to hear how we can help implement and support programs that are already working and follow an equity lens.
Great. Thank you very much, Jess, I'm sorry. Erin Borla.
Hi, thanks so much. Erin Borla, she, her pronouns, Executive Director and Trustee of the Roundhouse Foundation. I'm based in Sisters, Oregon. We are a private foundation and fund across rural and indigenous communities here in the region, have done quite a bit of work around suicide prevention and firearm work. So excited to be here and share a rural perspective.
Thank you very much. Lori Palmer. Okay, Councilperson Vince Jones Dixon. Ready? Shannon Savell.
Hi, good afternoon. Shannon Savell, my pronouns are she and her. I'm the director of the Crime Victim and Survivor Services Division at the Oregon Department of Justice. We are the recipient of the Community Violence Intervention Grant through the legislature. It was initially funded with ARPA funds and now with general fund. It was $15 million for the first, I think, go around, and then $10 million this last session. So my presence here and my interests are almost exclusively how do we create a long-term sustainable funding platform. We're funding well over 50 grassroots organizations that focus on reentry, youth intervention, hospital-based violence intervention, et cetera. And we spend a lot of time laying groundwork and building relationships with these programs because historically many or most would not have gone to the Oregon Department of Justice, CVSSD, for funding. And one of the things we've heard almost to a person is a concern that there's going to be money put into this, but how is it going to be, how's it going to be expanded, how's it going to be continued? And once they build a foundation, who's going to be there to continue to call for increased investment? So that's, I think, my role. I have a team that's working on this, and to the extent that you need more information about our programs, what they're doing, who they're working with, et cetera, I'll be happy to bring all of that to this body, and I'm just grateful that you included us. So thank you.
Thank you, Shannon. In our next meeting preview, you will hear some opportunities for that info to be shared. So thank you. Next, Kimberly Rose. We have Kimberly. Nope. Okay, Dr. Carlson, Dr. Kathleen Carlson.
Hi, everyone. I'm Kathleen. I'm a professor of public health at OHSU and PSU School of Public Health and a researcher at the VA as well. And so I get to be steeped in all things firearm injury data related, which I'll share a little bit about today. And that may be the most obvious role that I have here today, and just what I love to is everything data and research oriented. So hearing what everybody's doing and being able to connect the dots between all of that, and hopefully be able to present numbers on reductions in firearm injuries in the near future.
Great. Thank you very much, Dr. Carlson. Representative Reynolds.
Hi, good afternoon. I am State Rep Lisa Reynolds. I use she, her pronouns. I represent House District 34 in Washington County. And I'm a pediatrician. And I really got my political start with Moms Demand Action for Gun Sense. I've been involved in gun violence prevention work, first as an advocate and now as a legislator, along with Senator Solomon. Have worked on gun bills since I arrived in the legislature in 2021, including and also the funding, the 15+10 that Ms. Chevelle talked about. Really excited to hear more about that. And you're right, we need some sustainable funding for some pretty amazing grassroots stuff. So really happy to be here. Thank you.
Thank you, Representative. Do we have Representative Boyce here? Not seeing Rep Boyce. So Senator Solomon, go ahead.
Hi, good afternoon, everyone. I'm Janine Solomon. I'm the senator for Senate District 15, which includes Forest Grove, Cornelius, Hillsborough, and the Rock Creek area of Washington County. I also have a background of Moms Demand as well, and working with the organization that truly is about addressing gun violence prevention as the public health crisis that we face. I get involved in this because gun violence to me is about safety of self, safety of others, safety of members of our community. I've had the privilege of working on legislation, and I really look forward to having this group provide a real factual perspective to legislators for future legislation, perhaps, and really, really interested in continuing to learn. And I thank you so much for this opportunity. And I will say, I apologize. I do have to go at 2:30. So if I go out at 2:30, I apologize. I had another meeting that I could not reschedule. So thank you.
Thank you, Senator. I'm going to do a real quick check. Did anyone on our member list pop in after I called you? I don't think so, but just want to get anyone who is in here. Okay. Seeing none, I'm going to keep going. I guess one thing I want to make sure that I as staff sort of relay to all of our membership and to our interested folks who are observing and may have comment or suggestions for us. My job, I'm not a member of the board, I'm a facilitator. And so I facilitate the meetings, but I also am here to provide you with any information that you need to help do this work. So like Shannon was talking about, there are other gun violence reduction grants out there, and we will talk about what programs already exist so that this effort does not become duplicative or try to take the space of something else that's ongoing. We can provide what research and information is available that might be helpful for you, connect you with resources, have informational presentations, all of those things. So if there's something you'd like to see happen that would help you make recommendations for grant funding in the future, that's what I'm here to help provide. So next on our agenda is just kind of some groundwork about what kind of expectations for the group. And for what it's worth, I have no concerns about anyone here in terms of being respectful. But we as an agency, we're talking a bit about guns can be hard things to talk about, and gun violence is for some people a really visceral thing to listen to and hear about. Based on experience or personal work or whatever the situation might be. So it just wanted, it felt incumbent on staff to make sure we're laying out that everyone's experience here is valid and useful. No one has to prove that they deserve to be here. And if there are things that I could be doing or anyone at CJC could be doing to make this a more useful space, a place that feels better to talk within, let me know in the meeting or let me know offline, whatever works for you. You will not hurt my feelings if I'm doing something poorly or that just isn't working for you. Please let me know, because what we want is to have this be productive in a way that is helpful and mindful for everyone. So I also wanted to see if there were any suggestions for how to do this in the best way possible. This is also something, if you'd rather think on it, we can come back to it. But I do think, especially when we start getting into more of the actual decision making, where some of you are going to have to disagree or sort of recommend one path over another, personal priorities, professional priorities are going to come up. And this is just something I want to lay out for everyone because, in theory, this might be a harder subject to talk about than other grant programs or policy programs we run. So I wanted to open this up to anyone who might have any suggestions or thoughts they would like to share about how to make this work for you. And again, if not now, feel free to reach out to me at any time, between our now and our next meetings as well. If not, if we are going to kind of blaze through our slides, Dr. Carlson, I'm going to introduce you next if you're on deck to go. All right. Again, if something comes up for someone that you think about, we have time at the end of the meeting as well to sort of share comments as well. And like I said, we will revisit that theme later. So our sort of key point for today is this gun violence presentation by Dr. Carlson. Dr. Carlson is a professor of epidemiology and environmental systems and human health at OHSU PSU School of Public Health. She's also an investigator and program director at the Portland Veterans Affairs Healthcare System. So we are really fortunate to have someone who is doing this kind of work and this kind of expertise in our state so that this information is so local and specific. So Dr. Carlson, I'm going to stop sharing and I'm going to let you share your screen and take it from there.
Okay, thank you, Bridget. Hi, everyone. So this will be the clunky part of figuring out this screen share here. See if we can get this. Do you see it now? Okay, do you see my cursor if I'm pointing things out? Wow, okay. And then as long as I can see all of you, which I would like to do as well.
And Dr. Carlson, would you prefer to take questions throughout or would you like to save them till the end?
I'm happy to take them throughout. I always get a case of the nerves and it's kind of nice to just like have it be more informal and sure. Talking with people. And I'll get into my professory role, but feel free to just like cut me off and ask any questions. And if I know the answer, I'll give it my best to respond.
Thank you.
So, okay. Well, thanks for the introduction. It is like kind of a mouthful. I have these two positions that straddle both the OHSU campus and the VA campus. I got my start doing injury research in the VA, really focused on veterans and traumatic brain injury and then suicide prevention. But most of us here in the VA also have faculty appointments and I'm 100% grant funded. So most of my grant funding comes from through the university right now, but we can toggle back and forth depending on where our research projects are. And all that to say, all that was meant to say that I keep my VA email. I respond most readily to my VA email and keep everything on the VA side calendar-wise, just because that's where I started and for simplicity. Okay, so I think that my charge today was to explain public health as a field and approach because of its role in injury and gun violence prevention, to examine some of what we know now about rates of firearm injury and gun violence here in Oregon and also nationally. And then excitedly, I get to share some of our research and evaluation projects and our programs that we're starting here, especially in the last few years related to firearm injury reduction and gun violence prevention. So first, just a little bit about public health and also injury epidemiology. This is near and dear to my heart. I was trained in injury epidemiology, and it's kind of the underdog of public health, and then public health, the underdog of medicine, and I always root for the underdog. So it's a field that I'm really incredibly passionate about. Public health, more generally, and this is an antiquated definition, but it still fits today. But it's the science and art of preventing disease. So traditionally disease, and then I have to insert injury, of course, since that's the underdog. Preventing injury, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. So if that sounds like pretty much everything, it kind of is. Like we consider ourselves kind of encompassing all of the systems in which we live, work, play, and navigate. And public health is woven throughout all of that. But underlying all of the systems is social justice. And especially in epidemiology and in public health, we see from the early years of our training just how unjust access to health is across our society, and how much of a role public health plays in trying to even the playing field for everyone in our communities. And so it's really like, the bedrock of all that we do. So public health takes a population level approach and focuses on prevention. And that's, in contrast a little bit to our healthcare system here, for example, where we may treat a victim, like one victim of firearm injury or gun violence at a time, or the criminal justice system, which can apprehend or punish perpetrators of gun violence one person at a time. And public health may touch individuals one person at a time too, but our focus really is on that population level. So systems level and upstream, the prevention of firearm injury before, we might even get close to an event happening. And so lots of times we're thinking about nudges and incentives or changes to environments or making equipment safer in ways that individuals may not even know that things are becoming safer for them, which is the best way, in fact. And so we're trying to think of those high level kind of passive measures that will keep people safer or healthier. And this involves a lot of people. So this is just an example of who might be partners in taking a public health approach to firearm injury prevention or gun violence prevention. This is just a snippet, right? But some of the key groups that really should be involved. And I think this is important to really reflect on, because gun violence especially is an all hands on deck situation. And there's so many levers that we need to look at, and kind of touch points that aren't yet being touched or intervened in. And it really takes a partnership of all sorts of people and with all sorts of expertise to be involved in this. So we have this very simplified model of the scientific approach to public health, essentially defining the problem. Usually that's quantifying it. So epidemiology is the science of public health, and developing those numbers that are valid and reliable, monitoring those numbers over time, monitoring numbers for different groups of individuals or different regions, to identify where higher risk may be. And then figuring out what are the risk and protective factors. related to an individual problem. Then moving on to what works to prevent those risk and protective factors, or prevent the risk factors, build the protective factors. And once we identify those successful programs or strategies, how do we make change so that those programs and strategies are actually implemented and then sustained over time? So this could be a whole career's worth of work, just evaluating one problem, coming up with one solution, and then moving on to getting it implemented. But we do this over and over and over in the public health approach. We really focus a lot on striking a balance, often between costs and benefits. So this could be monetary costs and benefits, but it also could be like, societal, emotional, health-related costs and benefits. One thing we often keep an eye out for is unintended consequences of interventions that we may be trying, and not have necessarily foreseen these consequences from occurring. Often that's through data, but evaluation that involves stories, collecting interviews with people who are directly involved or touched by certain programs or policies are gold in terms of telling us whether those have helped or hindered their ability to live a safe and healthy life. And then, of course, when it comes to guns and gun violence, we have this extra balance, which I guess isn't unique to what we're doing here. COVID certainly saw plenty of this as well. But balancing this belief, like fundamental belief that a lot of Americans have about individual liberties with also our belief in the need to be able to live a safe and healthy life. And where is the balance between that? And how does it get rejiggered, each time we have new information or new data? And guns is just such a complicated topic, and it's often, kind of dichotomized between gun rights versus gun control. And I think lost in that dichotomy is just all of this other information that could be helpful in reducing the negative aspects of gun injury in our population. So positive aspects, this is a very personal slide. This is my grandma, my brother, and my son. And I'm a kid from rural Oregon. So I understand like the role that guns play in rural life, especially, but in a lot of lives in terms of self-protection and autonomy and sustenance. Here, I guess rites of passage. And I'm not sure what my grandma was doing, probably shooting a mole is all. But these are the benefits. There are benefits of firearm ownership, but there are also costs. This slide is also my grandma, who was the victim of a shooting spree in 1963 out of Clackamas. And this was quite notable at the time. And I think a movie was eventually made about these boys that went on this spree. So she was impacted by guns. Also, my grandpa, her husband, this is always challenging to say, but he also died by suicide from firearm toward the later years of his life. So personally, and my family, I think we're not very unique in that we understand the benefits of firearm ownership and what the positive aspects can be, as well as the costs of firearm ownership. The core thing is that injuries are not accidents. So they're patterns and they're predictable, just like the colored pencils here. And when we study them through epidemiology and through a public health lens, those patterns become oftentimes glaringly obvious. And those allow us to then predict when spikes in injury or violence may occur. And because we can predict them, we can also work to prevent them. This saying is much more complicated, but I really like this in terms of understanding violence from a public health perspective. And that is that violence can be viewed as a normative and adaptive, human biological or evolutionary approach to what are often abnormal and maladaptive social structures or systems that humans are brought up in. So if we can understand it through this kind of environmental and developmental lens, that too gives us different levers or different kind of touch points in which we might focus on interventions upstream that could prevent what we're seeing downstream. Are there any questions? I should pause for a moment. Okay. Okay. So a little bit on what we've learned about the rates of firearm injury and gun violence. This is a slide that I often show that you can download freely from Whiskers, which is a CDC website. But this depicts the leading causes of death in the US. And this was the most recent data. I think we have 2021 now, but these rarely change year over year. But the point I'd like to make is that for all ages, unintentional injury is either the third in a non-COVID year or fourth leading cause of death in our country. Suicide is number 12, and homicide is down here, a few notches down at number 15 or 16 usually. But you know, those are bumped down by diseases of age, so heart disease, cancer, stroke here. And when you look at the younger age groups, injury, unintentional injury, and then interpersonal and self-harm injury play such a critical role in the health of our population. This is another snapshot comparing US to Oregon, and all ages over here on the left-hand side and youth on the right-hand side. So again, you see this unintentional injury being the fourth leading cause of death. Oregon, it was number 3. We did a little better with COVID being down in the rankings, but suicide we have up higher than we do nationally. And for the kids, we have all forms of injury as leading causes of death for youth in this country, and then also in Oregon. And what are the kinds of unintentional injury fatalities? Well, the leading cause by and far, far and away, is unintentional poisoning, so your overdoses. But then we have traffic crashes and falls, and then we have our intentional firearm injuries related, intentional self-harm and interpersonal violence from firearms. So if you add up these two numbers, it's like a 196 or just under that. So it bumps up to over the motor vehicle crash fatality numbers. And you may have seen headlines in these last couple of years about that, where fatal firearm injuries now take more lives than motor vehicle crashes. It was highlighted among kids especially, and I think just really kind of surprising to a lot of people. But this wasn't something that just occurred in the last year. I think the headlines kind of popped in the last year or two, but this has been occurring for a lot longer than that. And it predated COVID, in fact. So this is US rates of motor vehicle crash fatalities and firearm fatalities, with firearms here in the red. And you can see they're kind of stable here through the early 2000s. And then we start to have an upward slope starting in about 2010. And that has never slowed down. And in about 2015, 2014, we had this crossover with fatal motor vehicle crash injuries. And then at about 2016, this divergence where firearm injuries, the rates exceeded those of motor vehicle crashes. We have two things going on here. We definitely have this increase in firearm fatality rates, but we have a decrease in motor vehicle crash fatality rates. And there's a lot to be said about that I won't today, but we oftentimes contrast those two because for 4 or 5 decades now, we've had an enormous concerted effort to decrease motor vehicle crashes in this country through public health systems, through policies, through engineering of our roads and our motor vehicles. We have a national cabinet that focuses on surveillance and monitoring of fatal motor vehicle crashes. collecting all those data that can then inform interventions that we don't yet have for firearms, but I think that we eventually will. Hope that we eventually will. So in Oregon, our per capita rate of firearm fatalities is pretty much equivalent with the national rate. That means that, you know, nationally over 45,000 people died from firearm injuries in 2020, and almost 600 people died here in Oregon in that 1 year. In 2021, I'm starting to see the numbers now, and that number exceeded 600. So every year, 600 Oregonians right now dying from firearm injuries. It's a lot of people. Looking at just the kids, this is a 20-year, about 20-year conglomerate, but the number of kids that died in the last 20 years in Oregon could fill 5.5 school buses or 16 middle school classrooms. In 2021 alone, the number of kids who died could fill 1 middle school classroom. How do we compare with other states? We're kind of about in the middle. You can see Oregon there is, you know, we're a darker number, but not the darker state, but not the darkest state. So we have considerably higher rates of firearm fatalities than our neighbors to the north or to the south, but somewhat less than Idaho and Nevada. And this was a 2013 chart that I found, but I looked up the more recent numbers from the CDC site again, and this pattern persists to this day. So a lot of room for improvement in our state. And I think a lot that's different that, you know, when I've thought about it or chewed on this with people, like, yeah, okay, we can understand why Oregon might have higher numbers than Washington and California. By intent, nationally, suicide comprises over half of this pie chart of firearm fatalities. This is usually pretty consistent over time, but this is a 2020 chart. And in 2020, we saw homicide taking up a larger portion of the pie. And the other small wedges in there are unintentional or undetermined, legal intervention, which is your law enforcement involved fatalities, or undetermined. When we look at Oregon, we see a much higher portion of the pie related to suicide deaths. And this is just one of those patterns in our state that it really has to be considered and underlie our programs and our discussions around gun violence prevention. And I'm talking a ton about firearm deaths, but we know that deaths are just the tip of the iceberg, or the tip of what we call the injury pyramid. Usually in most types of injury, maybe even violence, the number of deaths is just one level of magnitude lower than the next level down, and then the next level down. So that, it just grows in magnitudes as you go down each level. Because firearm injuries can be so lethal, it's a skinnier pyramid, still important, but skinnier. So I pulled numbers from the 5-year period nationally. And so we had over 200,000 firearm injury fatalities in that 5-year period. And in that 5-year period, almost 81,000 hospitalizations, and then about 95,000 ED visits that were treated and released. So almost 1-to-1 if you consider like deaths to serious firearm injuries that were treated in our healthcare system. And then we just don't have data yet for these lower levels of the pyramid, but would like to. Ultimately, if you think about this pyramid, we either want to squish it down so that we convert more of those fatalities to non-fatal injuries that people can survive, or we want to narrow the base so that we have far fewer events in general of all types of injuries. And this is a snapshot from our newer, faster dashboard, which I'll talk more about in a little bit. But this is a program that we are working on in partnership with Laura Chisholm's team at the Health Authority. And these are data that we're making public through this dashboard, and it presents emergency department visit numbers for firearm injuries treated across the state. Here, I'm just showing you the snapshot of year over year, so you can see the difference over those years, and we're working on updating for 2023. And we update, every quarter or two to the most recent numbers that we have. Okay, so we have all sorts of models and methods to study firearm injury and the prevention. This is just one worth mentioning because it really is kind of the foundation of a lot of our work. The social ecological model represents to us how individuals that may be involved or at risk of firearm injury and have their own individual risk factors, that a lot of us work on in our day-to-day lives. These can be modified to keep people safer, but we recognize that individuals are embedded within relationships that themselves also have risk factors or protective factors, and those are embedded within communities, and communities themselves are embedded within societies with social and cultural norms, policy, and it's really like, went backward. A lot of our work and our efforts, even in public health, kind of focus on this individual level, but the further upstream, essentially, that we can go, the more impact that we can have across populations in notching down those numbers or the rates of fatal and non-fatal firearm injuries. And that's what we aim to do. So this is just an example of using the social ecological model in a problem like gun violence prevention, breaking out each of those levels and identifying possible strategies for addressing firearm risk at each level. So improved sense of belonging and self-worth, for example, at the individual level, increasing pro-social bonds at the relationship level, eliminating racial segregation and the impact of gentrification on established neighborhoods at the community level, supporting policies for financial stability that address economic inequalities. Down here is employment, affordable housing, and so on. So the social determinants of health. So it's a helpful tool for thinking through all of the possibilities, and really like changing the conversation from the gun control conversation that just ends so much to like, look at all of this that we have to work on. And there's evidence behind these strategies. And there's probably 500 more that we don't have evidence for yet that we can develop and test for reducing the impact of firearm injuries. Yes, question.
Thank you. Thank you so much for the information. And I just wondered if, some of the conversation does seem to be divided between those urban and rural lines. And so I'm wondering, do you further break down this information to really look at county by county and ages and information like that?
We're building that. We're getting there. So I'll show you some more data from the FASTER project in just a bit, and you'll see it's broken down by counties in there. Yeah, we're trying to understand the county level differences, and then rural and urban, of course, plays a role. And I think about the differences between urban and rural risk factors, but I also try to think sometimes of the commonalities too. And because that helps bring us together. You have a lot of suicide that people think about in rural areas. You have interpersonal violence that people attach to urban areas. But what underlies all of that? Access to firearms, of course, and ammunition. But what about despair, financial hardship, mental health problems, substance use definitely is a common thread. So what are the connecting pieces? I think is also helpful in thinking about. But yeah, if you think of more, more information that could be drawn out county by county, that would be informative. We would love to know because we're thinking about these too. Yeah.
Can I ask again too?
Sure.
I thought back when you were talking about it, when we worked on the safe storage bill, you know, it really came down to for the urban rural conversation was that when somebody makes a call to the police, if you live in an urban area, they're there within 2 minutes. And if you're someone who's in Jackson County, that could be an hour. And so they really talked about like they use this, they need to have everything accessible for them because it is their protection of their family.
Yeah.
And so it is a really, you know,
So
it's an interesting,
complex.
yeah.
Representative?
I know I don't need to teach Senator Solomon this, but as a pediatrician who hears this from their families, you know, I'm just really grateful that there are safes that literally you can open with a fingerprint. And I know you know that, but I when I hear that too, I just have to keep leaning into, I can lean into my pediatrician role of yes and right. So, but yeah, but great point about also different messaging, maybe for different parts of the state. So thank you.
You know, and you think about law enforcement in urban areas too, and not everybody can equally rely on law enforcement in our communities here either. So that self-protection is so critical, like such a core emotion underneath all of this. So I love the rapid access safes and that being one option to help decrease the numbers of accessible firearms to those that shouldn't have access. We're trying, I'll mention this in a bit, but some of our VA work is rolling out demonstration tables to rural VA settings with demonstration safes, of the rapid access safes. And it's been eye-opening how few veterans are aware, or how surprised they are when they actually have hands-on a rapid access safe. And they're so excited about those. So there's a lot of openness to having those. And I think just having those actually be more accessible is one strategy to think about. Okay, speaking of our work here, so let's see, I'll start here. So I'm a, injury epidemiologist at heart, and so I love the numbers, and this actually really works in this field because there was a 25-year hiatus on being able to do any research on anything related to guns and public health. So we call it the lost generation of firearm injury research, and we're making up for lost time now with trying to establish reliable, robust data systems to produce these numbers. And this is so important so that we know kind of the foundation, like where we're starting. We know that it's been ticking up. Then are we going to be able to see notches down in relation to the rollout or implementation of different strategies. So getting our handles on the numbers is really important, filling in this pyramid. Understanding the causes and consequences, especially using that social ecological model and going upstream. And it's really hard work to relate or to statistically associate historical environmental factors or policies, or even modern day population level policies, and then the rates of firearm injury that we're seeing now. But we have the tools to make this happen. It just takes time and it takes good data. So we're working on doing that as well. That was my social ecological picture. Effectiveness of interventions. We're really interested in how the policies that we're rolling out in Oregon will be working. One thing we've started on is evaluating our state's use of the ERPO law, the Extreme Risk Protection Order policy that was passed, and I'll share a little bit of data on that if we have time. Our hospital violence intervention programs, which is considered an evidence-based practice, but the implementation of violence intervention programs at hospitals across the state, which is now supported by last year's House Bill 4045, is something that we are trying to study and understand that so that we can improve implementation and uptake of those effective programs at hospitals across our state. And then, of course, dissemination of the data to all of you, advocates and policymakers, which also takes time, but is the ultimate goal of our work. So this is just a snippet of our growing body of work. We got our first grant here to look at firearm injuries in veterans. And this was in partnership with Dr. Chisholm's team, again, at the Injury and Violence Prevention Program at OHA. But that was starting way back in 2015, and things were kind of quiet, you know, up through 2020. We started our VA work that I mentioned in 2020. And then Dr. Chisholm and her team and my team started this CDC-funded FASTER project, which started collecting those emergency department firearm injury data from across the state. This project has just been refunded for another 5 years, so we're really excited about that. And then it's just like grown exponentially, like these mushrooms that will be growing now in our forests. But so much work that's going on, and that's sorely needed. So I'll just mention a few of these. FASTER, which I mentioned, we were one of 10 states and jurisdictions that were funded for this initial FASTER project. So it's kind of a demonstration project. Now it has been refunded as a program called AVERT. FASTER stood for Firearm Injury Surveillance through ERs. And AVERT is Advancing Violence Epidemiology in Real Time. And that extends our work from just firearm injuries to other sources of interpersonal violence, including intimate partner violence, sexual violence, child abuse, neglect, and also mental health conditions. So we'll be using these same methods and expanding to these other public health issues, and then examining also how those are all kind of intertwined together. So I think we're just going to be growing exponentially in our understanding of these conditions in the years to come. So I think I already described this well enough. Emergency department data that we collect through the Oregon Essence system, which sits in the Oregon Health Authority. We've been able to produce this dashboard, and I may be able to pop our, let's see if I can do it. No, I might have to send it later, but I can give you the link to this dashboard, and you can play around with the different charts and graphs, and we're updating this. We're trying to improve it over time. And you can see rates of, well, this top map here is just the raw numbers of firearm injury ED visits. So of course you see the darker counties are the more populous counties in our state. But then when you look at per capita rates of firearm injuries, you see a little bit of a different picture, with some of our more rural counties being more heavily affected by ED visits for firearm injuries. So that's kind of, you know, one step that we're working in on the county direction. I'll share, I'll have to remind myself a little bit more on county work in just a bit. This is another project that we're really proud of and excited about, but it's small scale right now. But that the rollout of House Bill 4045 and expansion of hospital violence intervention programs across Oregon is so progressive and will undoubtedly make a difference. We're working with Roy Moore and his team out of Portland Opportunities Industrialization Center to help evaluate the implementation of this program at our one site here at OHSU. But what we're hoping to do is develop kind of a toolkit out of our understanding of the implementation here that can then be useful in their helping guide implementation to other healthcare facilities across our state. So I think in the interest of time, I'll skip over these, but this is really exciting work to us. We're taking a participatory evaluation approach so that we're less researchers and research subjects and more equal participants in conducting this work, partnered between, you know, this kind of historical, bureaucratic, big healthcare institution literally on the hill and the community that it's trying to assist down the hill community of color that hasn't often been in equal partnership with OHSU. So we're taking this participatory approach, and through this approach, over time, we've co-created a logic model. We've used shared decision-making on our methods and our methods of data collection. This is the logic model that the teams come up with. But what we're really excited about is that the team decided to take a photo voice, use a photo voice method. And what this will do is we're focusing on the intensive case managers. So these are the professionals with lived experience who come and sit bedside with victims of firearm injury or other violent injury, who are people of color, usually youth up to age 25, 35, and help guide them through the healthcare system and then through discharge and recovery for up to 18 months afterward. So these intensive case managers have their own stories to tell. And we're starting with them in deciding how they tell their own stories and what stories they tell. So what we're going to end up with here is a photo exhibit that will show at OHSU and maybe in other public spaces around the state that should present their experiences prior to becoming intensive case managers, while they're intensive case managers, their experiences working with clients who are victims of violence. And I think it will be really illuminating. And we hope that it will help build support for these programs in tandem with the rollout. Another effort that we're working on is the CJC-funded Multnomah County Gun Violence Review Commission, which we're also really excited about. This is less research, so it's a little bit more foreign to me, but this is an age-old public health approach that brings together experts in different agencies and disciplines that all kind of touch on this certain health condition that's occurring. In this case, gun violence, we're not even requiring it to be fatalities. But the purpose is to comprehensively analyze and understand the causes and antecedents of gun violence, and then to generate and implement evidence-based recommendations to reduce gun violence in Multnomah County. When I was saying this is an age-old historical approach, we in public health have often used it for child fatality review, sometimes review of elder abuse and fatalities or intimate partner fatalities. It can be really effective when you bring together different disciplines with different experiences and different data sets, and across the lifetimes of the individuals involved in these events, you can piece together where gaps may have happened, where agencies didn't connect, where the safety net wasn't in place. And then this group and the leaders that are overseeing the group make recommendations and then work to implement these recommendations. So over time, hopefully we're patching together the gaps that people have slipped through. So I listed some example commission members here. We're just about to launch our first orientation meeting this fall, and collecting data to review some of our first cases. I think I ended up describing this. One point I can make is that the city of Milwaukee has had a highly successful homicide review commission, and they are serving as mentors to us as we launch our commission here. And they've provided enormous help. Sometimes we contextualize for our region the advice that they give us because the environments that we're both working in differ in some ways. But overall, really incredible guidance that they give us. And this is just an example. I keep talking about upstream drivers of firearm violence. I wasn't sure where to put this, but I think it makes sense with the commission. Really what we're trying to do here is connect the dots between the upstream social drivers of gun violence and firearm injuries. And they're there, right? We just haven't had these data systems to make the connection obvious. This is one map that we're just launching on our ability to map here in sophisticated ways. But this map, one of my team members made, and it shows the city of Portland. And it's broken out by the social vulnerability index by neighborhood in Portland. And so the lighter colors are less social vulnerability and the darker colors are more social vulnerability. And social vulnerability is a kind of an amalgam measure using census data of like household income, education, density, number of parents in the household. And so higher social vulnerability, you can kind of recognize being in North Portland, East Portland, and you can just see how the black dots, which represent firearm shootings taken from gun violence archive data, how those overlay really well the social vulnerability, the neighborhoods with high social vulnerability. So overall, 70% of the firearm injuries in Portland occurred in the census tracts with medium, high, or high social vulnerability. So that's just one example of kind of making the case that moving upstream can be effective if we can creatively think of ways to reduce social vulnerability, for example. This is another upstream driver that we think about too, and that's substances and substance use and the role of substances in firearm injury and gun violence. And how critical that is. It's just a quick snapshot. So I want to do a time check. This is the last study I was going to share, but I have a few slides on this study.
Dr. Carlson, we have time if you're
okay.
If you're able. Thank you.
Okay. Thanks, and apologies, I'm talking so much. This has been a really interesting evaluation. This was an unfunded study that a medical student approached us and wanted to conduct for her research piece of her medical degree. And so she launched us on this. Now she's long graduated in her next phase, but we're still working on this and we're getting closer to having really robust data on how our ERPO law has been used. And I think this is relevant to our advisory board's work here. So I wanted to share a little bit more information. But our ERPO, or red flag law, was implemented in the beginning of 2018. So we have now 5 years plus 2023 of data on its use. The law allows family or household members or a law enforcement officer to petition a civil court for an order to temporarily restrict a person's access to firearms or other weapons if the court determines that the person is at imminent risk of causing harm to themselves or others. Our law requires that the petitioner must meet a burden of proof, requiring clear and convincing evidence for the petition to be approved. An ERPO typically extends for 1 year unless a request to terminate earlier occurs or a renewal is granted. And ERPO laws more and more are receiving attention and are being taken up and implemented across more and more states as effective tools for preventing firearm suicide especially, but also homicide, and then quite a bit of interest in preventing mass shootings. So our team of students and myself and my colleagues have received access to ERPO petition data from the Oregon Judicial Department. We're extracting information from every single petition and then double coding those petitions, a portion of those petitions too, to make sure that we're getting this right. And then so far we're just conducting descriptive analyses to understand the frequency of use of ERPO, who's filing petitions, how often they're granted, how often they're denied, why they're denied, and so on. So there's still some counties that have fewer than 5 petitions, and we suppress the information for those counties for privacy, kind of data stewardship reasons, which you'll see here. But here's what we're seeing so far. So just in this 5-year period so far, we had almost 650 petitions filed and 78% that were approved. And this didn't really change, the approval rate didn't change too much year over year. But we did see the number of petitions filed increase year over year. So I think the word is getting out, and more people know that these can be filed when needed. So there's a number of counties that haven't filed ERPO petitions yet, but 81% have filed one or more. The average is about 11, or 13.9 per 100,000 residents. And you can see the map over here. And interestingly, we're going to level up in our sophistication and show, try to show this map contrasted with our map of violent deaths per county across the state. So you can kind of contrast that. But we've looked at simply at the statistics, and interestingly, we show that number of ERPO petitions by county is negatively correlated with the number with the rate of fatalities, violent fatalities by county. So there's some correlation going on there that we'll look into more as we finish extracting these data. Most of our petitioners so far have been law enforcement officers. You can see that in this pie chart down here, followed by family members, intimate partners, and housemates. And we found so far that law enforcement officers who file petitions, those are the most likely to be approved, almost all of them, while those filed by intimate partners were the least likely to be approved. And often what we're seeing so far with this is a lot of times those intimate partners don't necessarily have standing if they're not married to the individual or living with them. So they may be an ex-intimate partner, they may co-parent, and they may have what seems like strong cases, but they don't have standing according to this policy to file an ERPO petition. So the largest percentage of petitions cited assault as the threat, and these are not mutually exclusive. So a lot of the petitions cite both threat of assault to others as well as self-harm. About half of them, in fact, mentioned both. Threats to children were mentioned in 15% of petitions. And in 72 petitions, they cited a threat of mass violence. And of those, we had a pretty high approval rating, interestingly. Now, the respondent, so the person that the petition is filed against, can request a hearing. And in these cases, about 21% of petitions, the respondent requested a hearing. And when a hearing was held, almost half were dismissed. 42% of the ERPOs were dismissed. So, it looks like there are those aspects of the policy that are working to give people the ability to be represented and to represent themselves to the court, and to kind of balance the petitioner and the respondent sides of the claims made. So the most frequent reason for petition denial was insufficient evidence, followed by not having standing, not having a qualified relationship. And our take homes to date is what I mentioned, that the use of the law seems to be increasing each year since its implementation. It seems to be, according to what we read in these cases, it seems to be being used as intended in attempt to prevent fatal and non-fatal firearm injuries, but that guidance for petitioners may be needed so that petitioners who are not law enforcement officers especially know how to complete the petitions and know what a qualified relationship is, how to get support when needed, and so on. So we're continuing with this research. These are preliminary results, and we're finishing up our coding now and should have more solidified results in another month or two that we hope to be able to share. I think that was just doubled up. Yep. Okay, so that's all I had. Thank you so much. And I always end on this slide too, just to leave you with some of the resources after being steeped in all of this very heavy-hearted information.
Thank you so much, Dr. Carlson. I see Rep. Reynolds has her hand up.
Yes, thank you. Thank you for this really important work and presentation. I suspect you saw, I think last month, that it was the Secretary of State audit of ERPO, and yes. Oregon has a particularly low use of this really important tool. And my thinking on that, and just a little bit of reading I've done, is that most people don't realize this is a tool, and you're right, Dr. Carlson. Maybe some of the people filing it don't understand, but it is a pretty tight definition of I think it's right, spouse, sibling, parent, or child, I believe.
And housemate too. For family member, you're thinking of, yeah, housemate too.
Okay. And then law enforcement, which I was happy to see that map, that there seem to be some uptake in some of the rural communities. One thing that I've been contacted by psychiatrists, they would like to be able to be petitioners, and I guess that's something I'd love to understand better. Like, what are the ways to make IRFO used more in our communities? So I think one thing is expanding the number of people who can petition for it, and then, expanding the knowledge that this is a tool that we all have. And what psychiatrists tell me, especially around the suicide issue, is that family members feel pretty uncomfortable disarming their struggling,
I can imagine.
Yeah.
Yes. Yeah, I can imagine. We're thinking about that too, and we saw some healthcare providers as petitioners in the data set, some of which were approved actually.
Oh, really?
And some denied. Yes. So it's interesting to go through these and see what's actually happening practically. But yeah, the psychiatrist makes sense. On the flip side, we've heard some physicians say that maybe there's rationale for not including them, which made sense when they were saying it at the time. But I think carefully thinking through that, and then improve. There are definitely improvements that can be made. A lot of where our mind goes at this point is the implementation pieces. We're seeing some judges systematically deny petitions. So I think there's still some of those, fundamental beliefs too that come to play. So a lot of nuances in these data. Which are interesting. And I haven't read that report yet, but it's open. It's still open on my desktop, waiting for me. Hi. Michael. Hi. Did you have a question?
No, thank you.
Okay.
I did submit comments in writing. I hope that those made it in.
Hi, Michael. Yes, we have public comment period after our presentation, and any written comment we'll send out as part of the meeting materials. So thank you for that reminder. Are there any other questions for Dr. Carlson about her presentation? If not, thank you so much. I found this super helpful, and I know that we'll get to draw on your expertise throughout this project. Next on our schedule is public comment, but I did notice that we had two advisory members who missed our initial intro first couple minutes. And so Counselor Jones-Dixon and Representative Boyce, would you mind introducing yourselves? We did just sort of who you are, any sort of professional or volunteer role that you might play, preferred pronouns, and then maybe a why statement or why you're interested in this work. Any piece of that you'd like to share would be super helpful.
Yeah, I can go first. Can you hear me okay?
Yes.
Great. Thank you. My name is Vince Jones-Dixon. I serve on City Council in Gresham, the City of Gresham, and this work is extremely important to me. I've lost two brothers to gun violence, specifically, one of which was 10 years ago. So I'm just looking forward to just serving with you all as far as coming up with solutions. And I jumped on to this meeting sort of late, but I enjoy what you shared, Dr. Carlson, as far as the whole participatory model with communities that have been directly impacted. Rings it lights my spirit up, so I'm excited to just be along and to serve in this capacity with you all. So thank you. And then also professionally, I serve as a funeral director as well. So I've been serving for about 15 years. So I've been able to just guide families through making end-of-life arrangements and pre-arrangements, and have served a number of families that have been impacted by just gun violence and violence in general. So again, I look forward to sharing those experiences and participating moving forward. So thank you again.
Thank you very much, Counselor. Representative Boyce, are you still here?
Good afternoon. Yes, just listening in here and there. Thank you very much.
Great. Well, thank you very much. We're going to go next to our public comment period. Do we have any members of the public? Oh, Representative Reynolds, go ahead.
All right, one more question. Will Dr. Carlson be sharing her slides with us? That would be awesome if that's possible.
I'm happy to.
Great.
Yeah.
Thank you. Appreciate
Should I send them to you, Bridget?
Sure, that would be great.
Yeah.
Then we can send them out as sort of the meeting materials package.
Awesome.
Okay.
Thank you.
Thanks for asking.
All right. Are there any members of the public who would like to share a public comment? And as I noted, if you would like, if you have sent one in writing, you are still welcome to make an additional public comment. I will send out the written materials with the meeting materials. So just FYI, but this is your time. Anyone's welcome to make a comment or ask a question. Michael, would you like to say something? I think you're on mute if you are.
All right. Can you hear me now? Yeah,
Yes.
I apologize for, I was tied up and I didn't get a chance to hear the doctor's presentation, and I hope that you'll send out that material to the public and look forward to looking at it. And I just have to say, I am an active shooter. I do target shooting, skeet shooting, and I just would hope that we would make this group would make due consideration of the Second Amendment. And let me put emphasis on, I think both the pro and anti-gun folks have an inaccurate understanding of the Second Amendment. And so when I say Second Amendment, I don't mean that as a blocker. I mean, it's really important to understand what exactly the courts have determined that means, because it somewhat defines the field that's available for effective policy that will stand a court test. And the other thing that the shooting community, feels like oftentimes we get left out as the legitimate users of firearms that are just as concerned about the misuse of firearms and the violence associated with that's not in any of our interests, and it's certainly not something that is representative of the gun ownership group as a whole. And if we can somehow get the dialogue open so that, we feel like, our concerns about access to guns that we use for hobby use, for limited self-protection, and those things, they kind of get overridden. And I understand that if you're not a gun enthusiast and if you've been a victim of gun violence, all guns kind of look bad to you. And I certainly appreciate that point of view, but I would ask that people try to understand that those of us who use guns for lawful purposes, for target shooting and sport, have a different relationship with guns, and it is a complex problem.
Thank you very much. Thank you very much, Michael. And yeah, we will make sure that we send out what you submitted as part of the materials. Do we have any other public comments or questions from anybody else, or any member of the advisory board? You're also welcome to share anything else you didn't have a chance to note during our meeting. Not seeing anyone. So our next meeting is in October. We're doing these monthly. We will take a scheduling look to make sure that this time still works for everyone. We did have a couple, you send the doodle poll in the summertime, and then people in the fall, their schedules shift a little bit. So I want to make sure that this is still a good time for most of our folks. But what we're planning to do, today we wanted to do sort of an intro, get a chance to see everyone, relatively speaking. And our next meeting will review a little bit more about what the grant opportunity provides for. It is a federal grant. It is an offshoot of an existing federal grant program. So there are a lot of sort of nuts and bolts that it would be helpful to just do a refresher, or it might be brand new to some folks too. And then Shannon mentioned this, she had to jump off a little bit early, but there are also existing grant programs to address or provide for opportunities to support gun violence reduction or intervention programs. And we want this opportunity to be, not duplicative to the extent possible, to sort of fund things in a new way, wherever possible. So we'll have an update on what is going on there. Dr. Chisholm, I will ask you for help on sort of OHA piece because you've been doing lots of good work there too. And then each of these meetings, we will look to do an informational presentation. I have two sort of competing things that might happen next meeting, so I don't want to promise one and then not deliver, but that's sort of the tenor of these meetings. We're going to spend the first couple just getting our bearings, and then eventually, this is the group that will be making recommendations to the Bureau of Justice Assistance for what Oregon's grant award should go to locally. It is a little bit of a different grant insofar as the final decision is still with the feds. We can make recommendations, but we'll get into that next meeting in lots of detail. So I don't want to belabor that now. With that concludes what we had planned for today. Again, are there any last questions or thoughts? And you're always welcome to ping me outside of meetings too if you have ideas or suggestions. So seeing none, thank you all for being here. Thank you, Dr. Carlson, so much for all of your information and expertise. And I will look forward to seeing you all next month. Thank you.
Thanks.
Everyone.